Welcome into clinic. As I discussed with you on the phone, you had some results of your carrier status that you both decided to do testing for when we met during our last session. And so if you remember, we talked about testing some recessive disorders and determining if both of you are carriers. And as I talked about on the phone, what we did find is that you were both carriers for a CF mutation. So what that means is that you each have one copy of your CF gene that is not working properly. And if you remember, CF or cystic fibrosis is a chronic lung condition and can bring along a number of medical conditions. What this means for future planning is that you have a 1 in 4 or 25% chance of having a child affected with cystic fibrosis. So this means that you would both pass on your non-working copy. And so since this is a recessive condition, both of your children, your child needs to have 2 non-working copies to be affected. When a couple finds out that they're both carriers of a recessive condition, this usually brings up questions about planning for the next child. And that brings me into the options that you have for something we call assisted reproductive technologies. And that's a fancy term for technologies to assist you in family planning or reproduction to greatly reduce the chance of your child being affected with a condition like cystic fibrosis. And so what this usually entails is something you may have heard of, which is called in vitro fertilization, or IVF. And what we do is combine that with genetic testing into a whole process that we call pre-implantation genetic diagnosis, or PGD. And so what this means is that we are going through a number of the regular reproductive processes in the lab, testing those developing embryos, and only choosing those that are not affected to result in pregnancy. Now, sometimes this can be confusing while we're talking about these types of technologies because most couples who have come to this point don't usually have fertility issues and have never thought about using technology like this. And we know that you have conceived and carried a healthy child, a healthy baby girl, and so it seems odd to be talking about fertility procedures. But we have to go through these types of procedures so that we can test the embryos in the lab. And so what this entails is a number of steps, a lot of medical visits. Sometimes this is covered by insurance and sometimes not. It can be about $15,000 to $25,000. The success rates are pretty good. They usually vary by clinic, so whichever IVF clinic you choose, you would want to talk to them about the success rates for things like the age of the mother and father and what disease they're testing for. The procedure carries pretty low risks and has pretty high success rates as far as accurately testing the embryos, but success rates are low in terms of establishing a pregnancy. And again, we can get into that if this is something you think you would be interested in. So to do this type of procedure, there would be a couple steps. We would monitor your ovulation cycle, and we would stimulate ovulation. So you would ovulate more eggs than you usually do in a month. We would retrieve those eggs through a procedure, and we would bring those eggs into the lab. Meanwhile, we would collect sperm from you, and in the lab, we would actually inject the sperm into the egg, therefore fertilizing the egg. We would let those embryos develop in the lab, monitor those, until about day 3, when the embryo is around 8 cells. We would take out one cell and test that cell for its genetics. It doesn't harm the developing embryo to take out one cell at that point. We would determine by genetic testing if that developing embryo had 1 or 2 mutated copies, and if they would be affected or carriers. We would choose not to use any embryos that could be carriers or affected, and so we would only move on those embryos that had 2 working copies of the CF gene. At that point, we would choose which embryos looked healthy and transfer one or a couple and hope that that results in a pregnancy. And so those all include some procedures, as you can imagine, with some medication, and they're not the best procedures to go through, but of course there's help with pain and things like that. So again, we can talk about if this procedure even sounds like something you would want to do. Again, these procedures aren't perfect, as you can imagine what we're trying to do in the lab, but sometimes it is an important technology we can look at if you would like to reduce or eliminate the chance of having an affected child. So next we can go into some questions that you have about assisted reproductive technologies. We can talk a little bit more about how PGD is done, any risks that go along with it, and we can talk about some general family planning issues and questions. Thank you. Thanks for listening. PGD Puppy!